Hello, my name is Destiny Belcher, and I will be doing the OSCE today on my patient, Mr. Corbett. This is Mr. Corbett. So first, I'm going to start off by checking the patient's skin turgor. Have your hand, please. So I'm going to pinch the skin upwards and then let go and check to see how long it takes for the skin to return back to its normal state, and also check to see if there's any tinting. So next, I'm going to assess the patient's temperature. I'm going to take that by taking the back of my hands and we're going down the sides of his arms like that, and then the legs to see what the temperature of the body is, and his temperature is warm and dry, so that's normal. And now I'm going to check the patient for their skin color to see if they have any rashes or moles or any lesions or anything on his extremities. So next, I'm looking at the arms to make sure he doesn't have any rashes, bruises, lesions, or anything of that nature. Okay, I'm going to do the same thing by looking at the legs. And then I'm going to then check his nails and assess for color, thickness, and if there's any brittleness. So hold your hand, please. Okay, so I just inspect the patient's nails and make sure that everything is normal. All right. And then finally, I'm going to assess for capillary refill. So I'm going to take the patient's hand and gently press down on the nail until it turns white. And then when I let go, I'm going to assess for how long it takes for it to return to normal color. And that should be about 2 seconds or less. Okay, now I will be doing the eye assessment. So first I'm going to assess the patient's eyes for symmetry. So please look straight at me. Okay, looking at the left and right eye, making sure they're both symmetrical. Okay, now I'm going to assess the patient's conjunctiva. So can you take both fingers and gently pull down your eyelids? So we're assessing the conjunctiva to make sure that it's the appropriate color, and then also looking at the sclera. Okay, you can go back to me. Thank you. All right, now I'm going to assess for extraocular movement by asking the patient to follow my pin cap. Okay, so can you follow the pin cap with your eyes, please? Thank you. And next I'm going to assess the patient's pupil dilation and accommodation. So I'm going to do that by using this pen. For the purposes of this video, the pen is going to be a pen light. So just look straight at the light, please. Okay, now just stay there and just look straight ahead. And so I'm just following with the pen cap to make sure that the patient's pupils react appropriately. Okay, so now I'm going to do the vital signs and respiratory assessment. I see your wrist, please. So I'm going to locate the radial artery on the thumb side of the wrist, and then I'm going to press down to palpate until I find that pulse. And then I'm going to count the number of pulse beats in 15 seconds to obtain that rate and multiply that by 4 to get the beats per minute. And then while I'm doing this, I'm not going to notify the patient, but I'm also going to assess the patient's chest for breath movements and count for 30 seconds. Then I'm going to multiply that number by 2 to get the respiratory rate, which will be the breaths per minute. So now I'm going to use the stethoscope to assess breath sounds. So I'm going to listen to the patient's breathing by first starting at the apex of the lung, so here, and then take a deep breath in. Okay, then I'll go to the other side and do the same thing at the apex of the lung. And then I'll listen to the right upper lung. And then the other side on the left upper lung, into the deep breath. And then I'll go in at the right middle lung. And the left middle lung. And then the right lower lung. Deep breath. And again on the left side for the left lower lung. So now I'm going to perform the peripheral vascular assessment portion of the test. And first I'm going to palpate the dorsalis pedis pulse, and that is at the top of the foot. So I'm going to take my 2 fingers here at the top of the foot and palpate for that dorsalis pedis. And now I'm going to do the posterior tibial pulse. So that is on the inside of the foot near the ankle, so between the bone of the ankle bone and the Achilles tendon. So I'm going to take and palpate on the inside here with these same 2 fingers and find that pulse. Next, I'm going to check for peripheral edema. So I'm going to observe and make sure there are no signs of swelling, and then I'm going to press down on the top of the foot and make sure that there is no indentation. So now I'm going to do the nervous and musculoskeletal portion of the OSCE. So first I'm going to observe the cranial nerve 7, and then I'll do the cranial nerve 12. So the cranial nerve 7, I'm going to observe the patient's motor function of the face. So can you please raise your eyebrows? Okay. And can you tightly squeeze your eyes? Okay, you can open them now. And can you wrinkle your forehead? Yes, thank you. And then I want you to frown. Okay, now smile. Now can you show your teeth? Show your teeth. Okay, thank you. And then can you like push your lips together like you're gonna whistle? Okay, now puff up your cheeks. All right, thank you. And now I'm going to assess the cranial nerve 12, and that's the hypoglossal, and I'm going to see basically the patient's inside of their mouth and their tongue. Okay, so can you just open your mouth? Keep your tongue to the floor of your mouth. Just like, okay. Now can you stick out your tongue? And like, stick your tongue up. Okay, now stick it back out and then side to side. Okay, there. Okay, so now I'm going to evaluate the patient's deep tendon reflexes. So first I'm going to start by positioning the patient's arm so that I can palpate for their artery. We're going to do the bicep. So I'll place your arm here and ask you to relax. Just leave that arm there. And then I'm going to place my thumb right where that tendon would be. And I'm going to gently tap. This would be a rubber hammer ordinarily, but for these purposes we're using this remote. So I'm going to tap lightly. I'm going to do the same thing for the other arm. Just relax and straight. And then we're going to tap here. So now I'm going to check the deep tendon reflexes for the patellar. I'm going to do that bilaterally as well. So I'm going to sit up straight. And then also for regular purposes, he would be sitting higher up with legs dangling. So I'm going to place my hand here with my thumb on the knee where that tendon would be. And I'm going to tap. And then I would do the same thing for the other side. There as well. Now we're going to assess for the patient's plantar reflex. And I would use the back of the rubber hammer. So we're going to go here on the bottom part of the foot and apply pressure and go all the way up. And then go across the toes. Okay, so now I'm going to assess the patient's gait and balance by using the Romberg test. For the gait, I'm going to ask the patient to please turn around and face that way. All right, can you please walk forward normally? Okay, perfect. Now can you turn around, please, and walk towards me on your heels? Yep. Okay, can you turn around and walk back that direction on your tippy toes? All right, thank you. And then can you walk back to me normally? Okay, perfect. Stand right there. Okay, I'll go back a little bit. Okay, so now I'm going to assess your balance. So can you just stand there with your arms straight by your sides, so stand up straight, and close your eyes. And so I'm just going to watch the patient for 20 to 30 seconds to make sure that their balance is appropriate and they're not swaying. Okay, thank you. So now I'm going to assess their balance using the Romberg test. So can you turn around, please? And I'm going to stand straight, balance yourself. Gently, we'll tug back on their shoulders pretty quickly and make sure that they don't fall.